Hi, I'm Dr. Greg Grillo with Express Dentist, and I'm here to talk to you a little bit about broken braces. Orthodontic treatment is pretty awesome. It allows you to move misaligned and rotated teeth into perfect straight smile and helps affect chewing and appearance and confidence and everything. But sometimes it's a process to get there, and the components that are used for moving teeth often involve braces, brackets, wires, and so forth. And because they're bonded onto the teeth, there are these components that can come free during treatment. So a bracket may pop off, a wire may break or come loose, or a band around a tooth may slip out, and sometimes elastics can come out from between teeth that are being used as spacers. So, because they are bonded into place and they are under some pressure, it is not terribly uncommon for one of these components to actually come free. And if this happens, we would not normally consider it a dental emergency. It needs to be repaired as soon as it's possible to do so, but it's not considered an after hours emergency. And there's some things that you can do to help if there's any discomfort that are associated with that. So when the braces come free, there is the possibility that there could be some sharp components. So if an arch wire comes out, for example, the end of the wire could be poking into your cheek, into your gums, and that can be definitely uncomfortable. Now, if an orthodontic band comes loose and it's not attached to the tooth at that point, if it's completely free, there would be a risk that you could swallow it, although it's probably not serious because it's such a small component. But in most cases, the brackets that come loose actually stay in place because they're still attached to the wire. So, what do you do if the braces actually break, especially after hours? Well, if it's a broken wire, that's fairly common, and because it is maybe poking into the gums or cheeks, the first thing you might want to do is try to cut it off. We don't recommend that usually. Now, you may be able to actually get a hold of the wire, maybe with your fingers, sometimes even with a pair of tweezers, and move the wire if it's shifted a little bit one direction. So if you can slide it around, it may get that end into a better position. But if that's not possible and you don't want to try to do anything that might cause damage, you may have some orthodontic wax, and you can put a little bit of wax over the end of the wire, and that can help as well. You can also do a rinse with like saltwater solution if you're starting to get a little bit of aggravation back in that area. Now, if you have a bracket that comes loose, that's again irritating, put a little bit of orthodontic wax over it. That's usually the best thing to do. It'll just kind of keep it in place. If it's not bothering you, you don't really need to do that even. If you have a spacer, these are the little rubber rings, look almost like a little elastic or rubber band. If that comes out from between the teeth, don't worry about that so much. You're probably not getting that back in there, and you just need to let your orthodontist know that that came out and that you need to get that put back in. So this is not normally considered an emergency. You just want to get a hold of your dentist, your orthodontist, to make sure that this gets taken care of. And you usually are pretty aware when this happens. You can tell that something's loose, and while it's not an emergency, it could affect the movement of the teeth over a period of several days. So it is, again, wise to get it rectified just as soon as you can possibly do it. You're not going to really fix a broken bracket at home. It's just something that the orthodontist needs to get put back into place, usually with some adhesive or reattachment of a spacer, that type of thing. You know, does it cost to fix broken braces? If you're in the middle of treatment, most orthodontists are not going to charge you for broken braces. If it's due to habits that are being repeated over and over, then there's a reasonable chance they will. And sometimes there is a policy that they have in place where they'll fix brackets the first several times, maybe 5 times, and then they will charge after that. Make sure you're clear with your provider when you start treatment how they handle broken wires and brackets. And so really the best way to avoid any damage to braces is just to watch your diet, especially with things that are really crunchy, hard, sticky, hard candies, hard nuts. Some of those things just aren't a good idea to be eating when you have braces, and just make sure you're taking really good care of everything, brushing, flossing, because another type of damage that occurs that most people don't think about is the slow damage, which if you're eating a lot of sugar or acidic type foods and drinks during orthodontic treatment, it can actually damage the enamel around the brackets and demineralize, we call it, take away some of that very valuable enamel. And so when the brackets come off intentionally at the end of treatment, you can have cavities underneath, and that can really undermine the treatment, obviously, and cause a whole nother set of problems. So if you have broken braces, you're probably in treatment currently with an orthodontist or dentist, and you want to get back with that provider as soon as you can and get everything taken care of. But if you are in need of a provider, maybe you're on vacation for a while, it's going to be a bit before you can get back, or you are no longer seeing a provider for whatever reason, you still need to get something done with those broken braces. And so if you need any help, please reach out to us at Express Dentists. We have a network of dentists and specialists, so we can help you get to an orthodontist even if that's what is needed. And so feel free to call us, and we can connect you anywhere in the country, and we're happy to do so. Good luck with your orthodontic treatment, and enjoy your new smile.